Dr. Krani, what interests you in starting a pediatric weight loss center?
We've been doing weight loss solution for adults for some time. And during this time, we have realized that weight problem is not only present in adults, but is significantly present in pediatrics. And this all children gonna be adult very soon and gonna affect significantly to our health care. Currently, 1/3 of Americans are considered to be obese or overweight. And during the past 30 years, this problem in children has tripled. About 27% of children from age 17 to 24 cannot qualify for military service just because of their weight problem. And the experts believe that the lifespan of these children at this time, when they become adult, will be about 5 to 7 years less than their parents. And the cost is significantly increasing as well. Not only that, just because of the weight problem, children have started getting diabetes, high cholesterol, high blood pressure, arthritis, gallstone, kidney stones, sleep apnea, reflux, that is heartburn. And all this problem not only cause physical problem, but they suffer from psychiatric problem. Significant discriminations against the obese child is present, not only at the school or outside, but starting at the parent level, at sibling level. Also in the sports, education, in any activity you see there is a discrimination. So now, not only that, it causes depressive symptoms to the child. The quality of a child with obesity is like a cancer patient. So if you overlook that, the children problem has to be focused and treated significantly. So that's the reason that we have started doing the pediatric weight loss center.
How does pediatric weight loss management differ from the adult population?
In the adult population, we define obesity as a BMI more than 30. While in children, obesity is defined by percentile of BMI. Means if the BMI percentile for that child for that age and that sex is more than 95 or more, it's called obese. And between 85 to 95 is overweight. So now, because their height is gonna grow, we really don't need to lose weight, but we want to maintain the weight. So what happens? The height goes up, the BMI becomes normal, provided that the children hasn't reached to maximum height. But if the child has reached to maximum height, then the weight loss is required to bring the BMI down. And we try to focus mostly on the cause of the pediatric obesity. So it's a lot of different than the adult. And main goal is to change the habits, change the lifestyle, and bring the BMI into normal range. And that's why it is different that way.
What are you offering in the Pediatric Weight Loss Center?
In Pediatric Weight Loss Center, as we discussed, the main focus is on the cause. And majority of time, the cause is our bad habits since childhood. So we try to focus on that to understand their habits. We try to get detailed history about whole family, not just the patient, but how the parents have an attitude towards the food, towards the lifestyle, their siblings. And once we understand their situation, and then we also offer blood test to make sure there is no underlying metabolic cause. We also check insulin level. Insulin level gives us an idea how much the craving kid would have. And also do body compositions to check their metabolic rate, their fat percentage, their muscle mass, their water content. And that helps us to idea that how much calorie person child would need. And then we determine the healthy eating habits, dietary therapy. Not only that, it's very important to make kid physically active. So we assess their screen time, how much sedentary lifestyle they're living, and how we can change it. We also try to make family understand that it's a family problem. And it should not be considered just a one child problem, but also a family problem and addressed accordingly. So overall, It's a global process, it's a multidisciplinary approach. We also have to use sometimes medication in children depending on the situation, the age, and what the BMI are. Because otherwise, if we do not focus on it, they have a high risk of getting more complication with obesity. So we try to focus mostly as a family problem. Rather than that, we whenever see the child or children for pediatric weight loss problem solution, it's as a family visit more than just a child visit. So it's very important that family understands that they play a major role in the children's health.